this presentation, we're going to explore the different parts of the eye and talk about the process of vision. As always, we're going to go over the notes again in class, and we'll look at lots of diagrams. We'll label some diagrams together, and we'll look at some models too. So we're going to start with the parts of the eye, and we're going to start toward the outer part and work our way in. So first of all, we have the cornea, and that's the tissue that covers the front of the eye, as you can see it labeled here. Next we have the iris, which is the colored part of the eye. It's actually a muscle. It's going to contract and relax according to the level of light. So it's what's responsible for letting in certain amounts of light. So when we are in a dark theater, the pupil opens wider to let more light in. When we go outside and it's very bright, the pupil starts to contract more to not let as much light in. The pupil is actually just the opening in the middle of the iris, that black spot right there. The lens, and this is an actual lens from an eye, it's what's used to focus the light onto the retina. The retina then is a layer of neurons in the back of the eye. So this is a picture of the retina, and you can see some of the arteries there and some of the other things. Now, in the retina, we have rods and we have cones. Rods are vision neurons that detect the presence or absence of light. So these help you to see in dim light, whereas cones are vision neurons that help you to see color. So if you think about little orange traffic cones, they're very colorful. So you can try to remember that cones help you see color. And here is a picture. The rods, you can tell, are a little more rod-shaped, and the cones are more pointy. They're more cone-shaped. We also have the optic disc, and that's where there aren't any nerve cells for sight. So this is your blind spot. And we're going to explore that when we do a vision lab later. And then we also have the vitreous. That's a liquid that fills the eye that helps to give it its shape and its form. Finally, then, we have the optic nerve, which delivers the messages to the brain. So the eye is collecting information. All our sensory neurons, our rods and cones, are collecting information and then sending it to the brain through the optic nerve. So in order to have the process of vision, you have to first have light. It doesn't have to be a lot of light, but there needs to be at least some. The light then is going to pass through the cornea, the pupil, hit the lens, which is going to focus it through the vitreous, which is a liquid substance. Then it's going to strike the retina, where our rods and cones are, which is going to create nerve impulses that travel through the optic nerve and to the brain. Just some vision problems, and we're going to look at some pictures of what it might look like to have these vision problems. Nearsightedness is where you can see things that are near very clearly, but you have trouble seeing things far away. Whereas farsightedness, you can see things far away very clearly, but have trouble seeing them close up. A cataract is the clouding of the lens of the eye, and then macular degeneration occurs when blood flow in the retina is blocked, and that can cause dark spots in the center of vision. Some questions that my students have asked in the past that you might be interested in are, one of them is, what about carrots? Don't carrots help you see better? Well, carrots have vitamin A, and a vitamin A deficiency is a cause of blindness, and vitamin A can help prevent night blindness, can help prevent cataracts and macular degeneration. It's not going to improve the vision that you currently have, though. It's going to help you from losing vision, but it's not going to make you see in the dark or anything like that. If you don't like carrots, though, you can always eat chicken liver because that has a lot of vitamin A in it, too. The leading cause of blindness in the United States, diabetes, glaucoma, macular degeneration, and then accidents like chemical burns or sports injuries. Eye color changes in about 43% of children between the ages of 3 months and 6 years. As the iris is exposed to light, sometimes the pigment granules in the iris can react to that light and change color. Also, as people age, their eye color can change because of a decrease in the number of pigment granules in the iris. Heredity can determine your iris color, and it can also be a factor in having low vision. Red eye in pictures, well, the retina, which lines the inside of the eye, is essentially transparent so that a doctor can see through to all the layers of the choroid. The choroids, where the blood vessels are located, gives the retina its reddish color, and so that can explain red eye in photographs. That's pretty much all for these notes. Remember, if you have questions, write them down, and we'll definitely use lots of models and look at lots of pictures in class to make sure you understand the process of vision.